Hello, I'm Tim Nanoff, AOTA's Director of Federal Affairs, and I'm here with Jennifer Hitchen, AOTA's Regulatory Counsel. Recently recorded a brief discussion of what the healthcare reform decision by the Supreme Court means for occupational therapy, but we wanted to take a little bit more time to talk about the significant impact the Supreme Court decision had on the Medicaid expansion provisions in the legislation. And with that, I'll turn it over to Jennifer to discuss those particular provisions, and then we'll talk a little bit about what they mean for occupational therapy and for the country in general.
On June 28th, the Supreme Court largely upheld the Affordable Care Act, or healthcare reform, but one of the things that they did was determine that the Medicaid expansion provisions in the law were in part unlawfully coercive. They essentially said that states can continue to operate their current Medicaid program as is and continue to accept the federal funding that they have currently if they wish. And it's optional if they want to comply with the Affordable Care Act and expand the coverage provisions and expand their Medicaid program and then get the federal funding that the Act allows for that expansion. The federal government will always kind of contribute to a state's Medicaid program, but under the Affordable Care Act, the federal government pays a huge percentage for the first 3 years, and then coverage drops off dramatically. One of the questions we have now is which states are going to comply with the expansion and accept the federal funds, and which states will continue to operate their programs as is.
I think the politics of this will follow along party lines typically. If you have states with a Republican legislature, a Republican governor, you're going to see them be a little bit more hesitant to follow with the ACA's expansion of Medicaid up to 133%. You're likely to see them drag their feet. One interesting option is, and we're not clear whether this can actually happen or not, would be that states might be able to take the federal funding and expand for the first 3 years, and then once federal funding drops back down to its normal matching percentage in each state, which of course it varies, once that federal funding drops back down to what the average is, then would those states cut their eligibility and cut their services back to what is the current levels that they have now. We don't know whether that can happen. I think there'd be some legal discussions and arguments about that.
Yeah, I think it would be, in one sense, politically difficult to do that, because at that point you would have citizens in your state that would already have expanded coverage for 3 years, and it's always pretty hard to take that away in the fourth year. I think there's also a legal question as to whether or not that would be allowable under the Supreme Court decision. The Supreme Court says that a state can keep their current program as is instead of complying with the Affordable Care Act. So the question would be, if they opt into the program and do that for 3 years, is it really being, unlawfully coercive to that state? Would they really be able to then disengage from the program and revert to an as-is state that they were 3 years prior? So I think that's pretty up in the air.
It's an important question. I think that over those 3 years we'll have time to clarify it. These laws can be changed, clarified, and amended. So that is likely to happen as we move forward with implementation. I think there's another big factor related to healthcare reform and what we thought healthcare reform was going to mean and what it means after this change in the Medicaid program is that we hope to capture, the government hoped to capture 30 million new Americans that would have coverage. This expansion of Medicaid was a significant portion of that people who were at 100% of poverty up to 133% of poverty. That change is significant in terms of the options now that state will have not to cover those individuals, and we won't see healthcare reform as broadly and uniformly covered as the president had hoped, and as AOTA had hoped in this process, because expanding coverage was one of our priorities, regardless of the actual form of healthcare reform. So again, I think we need to stay tuned for more information related to this Medicaid change and how healthcare reform is implemented. Thanks.